Hello and welcome to Season 5 of the NGO Whisperer Show. My name is Dr. Carolyne Opinde. I'm the founder of the NGO Whisperer and the convener of the NGO Whisperer Masterclass, the official sponsors of the NGO Whisperer Show. Here at the NGO Whisperer, we provide technical support to nonprofits and social enterprises so they can successfully impact people's lives. Joining us today from Nairobi, Kenya, is one of the NGO Whisperer Global Fellows, Edwin Gitau Kibe. He is the founder of Uhai Kenya. Kibe, welcome to the show.
Thank you, Dr. Opinde.
It's really a great honor and a pleasure to have this Season 5 of the NGO Whisperer Show dedicated to the NGO Whisperer Fellows, class of 2021. We are just so honored to have you. And so, Kibe, what inspired you to step into the nonprofit sector?
Thank you very much, Dr. Carolyne Opinde. I am a father of 3. I am an addiction professional, and I am in the field of humanitarian activities where I help humanity in so many ways. And it's also very important for me to mention that I am in recovery. I have been in alcohol and cigarettes, tobacco abuse. I spent most of my time in substance abuse, that is soon after graduation. But then while I was in it, by the grace of God, I was able to transform my life through treatment. And when I was in that situation, I really felt I was misunderstood, I was mistreated, I was stigmatized and also alienated. I mean, people did not want to associate with me. But soon after recovery, I decided that I'll pick up my broken pieces and also try and help out those who have left behind, because for sure, addiction to chemicals, addiction to alcohol and drugs is very rampant in our community and in our societies. So that's exactly what inspired me to what I do on the ground, helping persons with substance use disorders here in Nairobi, Kenya.
Your work is so inspiring, Kibe, because not only are you providing support to them, but you have also experienced it at a personal level as a recovering addict, as you've mentioned. What is the focus of your work? Where do you implement it? And who do you partner with to achieve the great success that you have achieved so far?
My biggest area of focus, and I believe this is where the rest of us should focus on, should be on prevention. If we can prevent it from happening, then we are sure that we are not going to spend more on treatment and rehabilitation. So I always advocate for prevention, primary prevention, giving services, creating awareness rather, building capacities of parents and the teachers and all the caregivers in the community, such that they can be able to prevent. And how do we do this? First, by having a strong family bond. That is number one, and it's very, very essential. Strong family bond, good communication skills, good decision-making skills. I mean, we equip these youngsters from the formative years before they reach to the adulthood or much later in life. So that's my main area of focus: students, underage boys and girls, and even in the corporate world, preventing. But all said and done, while I'm doing these preventive measures, I also come across people who have already gone past the prevention, people who have already indulged. So that's where now the second phase of my services comes in. I offer treatment. I take them for assessment. They undergo a thorough assessment so that we can see the extent of damage. And then based on that, we can now have them in inpatient program or outpatient program. So it's very, very important to go through the all phases of prevention, treatment, and actually finally rehabilitation and reintegration into the system, into the society.
That's such a comprehensive program that you offer. Now that you're working, under Uhai, I know you're providing services in different spheres, whether it's within schools, within communities. Under which body do you ensure that you stick to the guidelines and the protocols? Do you have such a body that is governing the work that you do? And how do you operate or collaborate with such bodies in Kenya?
Thank you, Dr. Opinde. In your previous question, you asked me to talk about who I partner with. And it's very important to say that we have so many quacks, so many unprofessional people who are just out to make money. And in fact, it has become even worse because people have commercialized the services because they want to make money. They have identified a gap. But it's very important to mention in this platform that we have bodies, we have associations that licenses us, that works with us to ensure that we are offering the credible services to our clientele. And in that connection, we have the Ministry of Health, which has many departments, but mostly the organization that licenses us is called National Authority for the Campaign Against Alcohol and Drug Abuse here in Kenya. It's in abbreviation, it's called NACADA Kenya. This is the institution that licenses us, that regulates us. On the other hand, we still have an association of Addiction Prevention Rehabilitation Association of Kenya. This is an association for all people who are in this field, either prevention, treatment, or rehabilitation. I am a member in these two institutions. Over and above that, I have worked with international bodies. I'm a member of quite a number of bodies. I am a member of International Society for Substance Use Professionals. It's based in the US. And then I am a member also of World Federation Against Drugs. It is based in Sweden. There are so many institutions which train us, which capacity builds us to empower us to offer good services to the community. It's very sorry to say that we have so many who are now coming up, mushrooming treatment facilities, and even counselors who are not qualified and who are not licensed. I would urge all our listeners and our viewers to be very careful, especially when you're engaging. Make sure that you have an accredited professional who is going to offer these services.
That is really important to ensure that whenever you're seeking for support from an addiction psychologist or a counselor, that they actually go to somebody who is accredited, such as you, Kibe. Now, we're going to take this a notch higher. We're going to take this a notch higher and speak about your participation at the NGO Whisperer Global Fellowship Program. You completed your 6-month course in December, running from July to December 2021. Would you please share with us, why did you sign up to be one of our fellows?
Thank you very much, Dr. Carolyne Opinde. First and foremost is to give my honest appreciation to the NGO Whisperer for giving me that opportunity to acquire the knowledge that I acquired from the masterclass. Let me say, I have always been wanting to build my capacities so that I can offer good services, so that I can offer the best that I have to my people, to my clientele. And this is exactly what I got from the NGO Whisperer Fellowship Program. It ran for 6 months, and to be honest and to be sincere to you people who are listening and those who are watching, it is worth it. It was a very rigorous exercise, but it touches on all areas. I, as an individual, I benefited. On behalf of my organization, Uhai Kenya NGO, it has had a very big impact, especially to my partners and to my NGO board of management. And now we are running things not as the ordinary way, but we are doing it professionally, because the people who are brought, the tutors, the people who are taking us through the program, they are at the best of it. They are the cream de la cream, the best of the best, I would say that. And I benefited. I wanted to acquire knowledge. I wanted to build my capacities. And thanks to God that this is exactly what I got from the NGO Whisperer Masterclass.
Thank you so much. We are honored to hear positive feedback from our fellows. Now, you mentioned there are areas of growth, there are areas of new knowledge and insights that you gain. Would you share with us your top 3 areas of new insights or knowledge that you have gained through the NGO Whisperer Global Fellowship Program?
Thank you. I would say that all what I acquired has been beneficial to me, but now you said I mentioned 3 or 4 of the areas where I felt that I really gained. Number 1 was the skills on resource mobilization. And I would urge all those who are watching us that before you engage, look for this professional help, because sometimes you engage in something that you're not very sure about, to identify where your capacities are and where you can easily benefit. There was also this area of the marketing skills, how to position myself for visibility. This is something that I really benefited, and I'm telling you, it has had an impact. Also, there was the issue of networking. The theory of change, this was another one, powerful one. I really benefited. And may I take this opportunity even to thank the people who took us through, very powerful, very skilled, very professional. They used all avenues to reach the message. I mean, their service delivery, oh my goodness, it was the best. Thank you, Dr. Opinde, and keep it up.
Thank you so much. We are honored. We are truly honored to have such positive feedback once again. Thank you. Now that you have completed the fellowship program, what changes have you seen or observed in your organization as a result of implementing the learnings from the NGO Whisperer Global Fellowship Program?
May I say this, that I have seen tremendous change. Reason being, when you build my capacities, I cascade it downwards to people who are with me, who I am working with. It enhanced the teamwork. And based on that, then came in the restructuring. The way we were doing things previously, we had to restructure. We had to bring in new, what do you call them, monitoring and evaluation tools on board, so that we can ensure that we are getting the best out of what we are bringing in, the input versus the output. I have seen a lot of restructuring, especially on programs and activities. I have seen a lot of redesigning of the way we were running things. And believe you me, I'm starting to feel the impact. For me, and even for the people that we serve, they are really benefiting far much better than before.
What does the future look like for Uhai, Kenya?
That is a good question, because the future is bright for us at Uhai, Kenya. Currently, we are serving in 5 counties. We are in Murang'a County, Nairobi County, Kiambu County, Laikipia County, and Nakuru County. In future, God willing, and with the help from the NGO Whisperer, I can see now we are going to widen our tentacles and reach at national level. We are going to be felt in all the counties. How are we going to do this? We are intending to partner more with the government. Yes, we are doing it even as of today, but now different counties, we need to come up with ways of working it out. We are going to reach out to more counties. We are also targeting to reach to more coverage of people, especially schools. Remember, I said we were in 5 counties, and in Kenya we have 47 counties. So you can imagine the dream is becoming bigger because of the way you've really assisted us in identifying our strengths, so that we can reach even more people. Because I'm telling you, there is a lot of help that is required here at the grassroots. And it can only be achieved through networking. Networking of who and who. I work with the schools, the education institutions. I work hand in hand also with religious institutions, the Muslims, the Christians, the Hindus, because we are not biased in any way. I work hand in hand with the national government also. I have to work with the regulating bodies like the ones I mentioned. And believe you me, the future is brighter for us. I mean, we are going to reach more people. In fact, I'm targeting that by end of this year, I will have reached more than 500 schools with a coverage of around 50,000 students or thereabout. And this one is going to reduce. Remember, we are targeting on delaying the initiation of substance abuse among the young people, the youth, and also stopping those who have already indulged. And also, in our future plans, I believe this is not the end with the NGO Whisperer. I mean, there are more programs that are on the way, and I wouldn't want to be left behind. I mean, I've tasted it. I know what there is. I know there is the benefits, and I would urge you viewers to come on board. Let's gain knowledge. Let's share this knowledge, and this is the only way that we can impact our people at the grassroots.
Thank you. Indeed, there's a lot that's coming up at the NGO Whisperer. We have our usual masterclasses that we offer. Once a month, we offer 2-hour free masterclasses. We also offer 4-week masterclasses on the same topic. And so members of public, non-profits, government officials, people from funding agencies, and representatives of various organizations are invited to join us at the NGO Whisperer Masterclass. There's a group on Facebook called the NGO Whisperer Masterclass. We have a similar group on LinkedIn, the NGO Whisperer Masterclass. That's where all our fellows, all our masterclass students congregate, and we share lots of information within the group. Kibe, what last message do you have for governments, for civil societies, and good citizens on addiction prevention, rehabilitation, and reintegration of those who have already engaged in substance abuse?
My message is one. First and foremost, let us acknowledge and accept that substance use and abuse and addiction is a disease. That is paramount. That is very, very important. It is a disease. When I say that it is a disease, what I'm implying is that let us stop stigmatizing. Let us stop labeling people. Let us help them just like you would have any other disease. I mean, it is similar. I said in the beginning of this that I was once in substance abuse. I'm in recovery. And if I had messed my life in the past, today I'm a different person. I'm impacting people's lives. And for your information, this was not my area. I have a bachelor's of commerce in accounts. I have a master's degree in project planning and management. Currently, I'm doing my PhD, but I still feel I have to touch people's lives. But stigma is eating our society. That is number one. Number two, to the government. Kindly, I plead with you, let us regulate the people who are in this field. There are those who are quacks, there are those who are offering substandard services, and they are making it even worse. I would rather these people are not there. So kindly the government, do as much as you can and contain them. Number three, can we have facilities being rent by the government with at subsidized rates, affordable rates, because treatment here in Kenya is damn expensive, and it's mainly in the private sector. So, there are those who have been cut off, those who have been limited to accessing the treatment services. I'm urging the government to come up with a plan, like, for example, they can have a wing in the hospital. The already established structures, can we have a wing in the hospital and have a treatment facility? Simple. And we are going to touch more lives. Let's also have the insurance covers. Let them be affordable to people. When you have the National Hospital Insurance Fund, let it be acceptable in these treatment facilities. To my CSO fellows, let's engage more with the people on the ground. let's do what we call proper need assessment, so that when you are touching on people's lives, this is exactly what they need. I mean, there is no way I can take my services in an area where there are no substance abusers. I mean, it would be irrelevant. It will not add value to their lives. So let's identify the needs. Let's do a proper need assessment in that area and do it diligently. Let's be vigilant. Let's talk to our children. Let's create time for our families, be a role model, and that way we are going to change it. I believe change begins with me. So, I mean, the change that I want to see in the community, like it was said, it begins with me. So let me give the very best that I can.
What a powerful message to governments, civil society, and individuals in communities on addiction prevention, rehabilitation, and integration for substance users and abusers. Ladies and gentlemen, we come to the end of our show. Kibe, where can people connect with you?
My handle is Kibe Edwin Gitau, both on Facebook and also on LinkedIn. And I have a website. The website is Uhai Centre.org.
Kibe, it's been a great honor and a pleasure to have one of the NGO Whisperer Global Fellows class of 2021 who graduated on the 29th of January, joining us here today on our show. Kibe, thank you so much. We wish you so much success. And as you mentioned, you are part of the NGO Whisperer, and there's going to be a lot that we're going to be doing together to help communities, not just in Kenya, but around the world, since you are certified globally by various international agencies that work in addiction prevention, rehabilitation, and reintegration of persons with substance abuse disorder. Thank you.
Thank you very much. May God bless your efforts. It's not in vain. Now the duty is on me to go and touch the people on the ground, impacting lives. Just like you say, networking, impacting lives, and of course, we need to raise funds to enable us to do this.
Ladies and gentlemen, we invite you to connect with us on our YouTube channel and follow us on social media. We offer training to nonprofits and social enterprises on the NGO Whisperer Masterclass. We hold exclusive masterclasses, and like I mentioned, every month we offer 2-hour free masterclasses and 4-week masterclasses. We ask you to go to our website and sign up for these masterclasses that are coming up. And we have a whole calendar for the whole year of 2022. For those who are seeking to be part of our class of 2022, the NGO Whisperer Global Fellowship Program, we ask you to go to our website. The applications open on the 29th of January. So we are looking forward to having you join the 20 fellows that we will have. Last year in 2021, we had 14 fellows joining us. This year, we are ramping up to 20 of you, 20 nonprofit leaders or social entrepreneurs who are seeking to be part of our rigorous program. You are welcome to apply and join us. The classes will begin in July. Every year they begin in July all the way to December 2022. Ladies and gentlemen, as always, it's all about connecting people, raising funds, and impacting lives globally.